and this week's contestant is looking for a kidney. Here are some reasons why she would need a kidney transplant. Our candidate today, Miss Anita Kidney, has polycystic kidney disease, which is an inherited kidney disease. Let's meet our candidate. Woo! Have a seat over there.
Okay.
So, Miss Anita Kidney, tell us a little bit about yourself.
Well, I have end-stage renal disease, and I've been on dialysis for 2 years. You know, I really just want to pee by myself. I have been living a healthy lifestyle. I eat healthy. I don't smoke. I don't drink. I live close to a donor hospital, so I'm ready to find my perfect match.
Well, let's meet our contestants. In order for them to be possible candidates, these kidneys had to go through several tests. Let's meet kidney number 1.
What's up? I'm Kenny the Kidney. I'm from a living unrelated donor.
Hello.
Hello.
All right, and our next contestant, kidney number 2.
I'm Perfect Peter, and I'm from a living related donor.
Hi, Peter.
Hello.
And our third and final contestant, kidney number 3.
I'm Danny. My donor's dead.
Oh, I'm so sorry, Danny.
The first test that our contestants must pass is the blood typing test. It's important for the donor kidney to be a match with the recipient.
Okay, kidney number 1. My blood type is A positive. What blood type are you?
O negative, baby.
I think that would work. Kidney number 2, what type are you?
I'm O positive.
Are you sure?
Excuse me, I'm A positive.
Oh, okay, that is perfect. Kidney number 3, what blood type are you?
B?
We might not work out. Kidney number 1. If you were my kidney, what would you do for me?
Oh, baby, I'd filter your blood real good.
Oh, that's so nice of you. Kidney number 2, what would you do for me?
Well, with me, you wouldn't have to worry about rejection, lymphocyte infection, or post-tubular necrosis, or even chronic high blood pressure.
Loser.
Bless you.
I like that. Kidney number 3, what would you do for me?
Well, I didn't do the best job in my last hose, but I tried to get out the really bad stuff.
That's pretty good. Kidney number 1, what would you do with my old kidney?
Probably let him hang out. We could party a little bit. Probably a great guy.
I don't know if I want my kidneys to party. Kidney number 2, what would you do with my old kidney?
Well, he may or may not still be there, but I'll be the main one.
Okay, that sounds alright. Kidney number 3, what would you do with my old kidney?
I'd stay out of his way and stick down by your pelvis.
That doesn't sound like you're going to be doing much for me. Kidney number 1, what happens if my body rejects you?
I'm sorry. Rejects? I don't get rejected, baby.
Well, I guess there's a first time for everything. Kidney number 2, what about you?
Well, according to my calculations, there's only about a 15 to 20% chance of rejection with me. So, I guess as long as you take your meds and live a healthy life, I'll be a perfect match.
Well, that sounds wonderful. Kidney number 3, what happens if my body rejects you?
Well, I'm used to getting the body's rejects, so I won't be offended.
Well, that's a little depressing.
The second test is the cross-match test. This test is used to evaluate the donor's and the recipient's blood to determine the interactions of their antibodies. Let's see a short video on this. tagging test, which measures the human leukocyte antigen. 6 antigens have been shown to be the most important for organ transplant. Although it is rare for a donor and a recipient to have a perfect 6 out of 6 match, it is more common if they are blood related.
Okay. So kidney number 1, on a score of 1 to 6, where do you fall?
I got a 2 out of 6. It's like a third. It's like pretty good, right?
That's not pretty good. Kidney number 2, what score did you get?
Well, I'm a 6 out of 6.
Of course you did.
That's a perfect match. Kidney number 3, how about you? What score did you get? 4? That's pretty good, I'll take it.
So before we find out who our perfect match is, let's hear a word from our sponsors.
Do you want to keep your body from rejecting your kidney transplant? Ask your doctor if Sandimune and a support plan is right for you. If you develop hypertension, ask your doctor about having your dose reduced. It is important that you keep taking Sandimune or another immunosuppressant for the rest of your life to prevent rejection of your kidney. Consult to your doctor before starting taking azithromycin, clarithromycin, amphotericin B, aminoglycosides, amiodarone, or anabolic steroids. Some people have reported tremor, hypertension, nausea, vomiting, and diarrhea, confusion, flushing, headache, psychiatric problems, nephrotoxicity, infections, gingival hyperplasia, hirsutism, psoriasis, abdominal discomfort, pancreatitis, anemia, thrombocytopenia, and hyperlipidemia. Stop taking Sandimune if you experience the following life-threatening conditions: posterior reversible encephalopathy syndrome, progressive multifocal leukoencephalopathy, seizures, and hepatotoxicity. Cyclosporin, for when you're in love with your kidney.
Welcome back to It's a Match. Are you ready to find out who our perfect match is?
Yes!
Yeah.
And the winner is kidney number 2.
That's me!
You've got to be kidding me!
All right, you two, let's get you to the hospital. We only have 24 to 36 hours for this transplant to be successful.
So here's your consent paperwork that the doctor just went over with you. Do you have any final questions?
Can you remind me of the complications of this surgery? Am I gonna die?
Well, the chances that you'll die are really low because your surgeons are really, they know what they're doing. They've done a lot of times and they have good technique. But the most common complication is kidney rejection, like I said before. And that's just when your body thinks it's foreign and attacks it. But as long as you're taking your medicine, it should be fine. And the doctors will be checking your labs. Increase in certain things would indicate it. But you can even treat rejection as long as they catch it early on.
Oh, okay. I think I'm ready.
Okay, I'll have the doctor come in and get you.
Okay. Well, I'll never see you again, but you'll always be a part of me.
There.
Your surgery went great. How are you feeling?
I'm feeling pretty good. I'm really happy that I found a kidney.
Good. So here's your prescription for cyclosporin.
Okay. I remember seeing a commercial about this once, but I don't really remember how it works. Can you tell me?
Yeah, so it's kind of listed right here. So it just inhibits your normal immune response, the factors in that. And then here's a list of adverse effects like hypertension, dizziness, confusion. And if you have hypertension, just let your doctor know. He'll probably decrease the dose. And it's really important that you take it once a week and really for the rest of your life, because if you stop taking it, your body could reject the kidney.
Oh.
But as long as you live a happy, healthy life and follow the instructions, you should be fine.
Okay. That sounds good to me.
Great.
I'm just so happy that I can finally pee by myself.
Yeah, and the number of the doctor's office on there, so if you have any questions, just let us know.
Thank you so much.
Mm-hmm.
And another success story from It's a Match.